View. Okay. And almost. So I'll start. And 1 second. Sorry. Thought I was queued up. And okay. Okay. Hello. I'm Dr. Matt Fleischman, and welcome to this webinar. This is the third in a series on what I'm calling ADD Successful Neurofeedback. And this is a repeat of the one that was given earlier today. And the topic they'll be covering is working with children, teens, and their parents. And before I get into today's topic, let me give a brief recap of what I covered in the first two webinars, and we can also give you links if people want to go back and watch those. In the first webinar, I discussed how I emphasize, it was the whole aspect of intake, testing, and preparing clients for the therapy. In other words, this is everything leading up to and before you do any neurofeedback. And in that webinar, I discussed how I emphasize the value of doing a more traditional assessment for attention problems. Most people come in and go, what's wrong with my kid, or what's wrong with me? And so I go down that road, including a clinical interview, formal testing, and a follow-up session where we go over the results. Conclusions are presented, treatment options are given, and of course, most often, one of the treatment options is neurofeedback. In the second webinar, I discussed that I do use pretty much the standard ILF protocols as outlined in the current manual put out by Sue Othmer. I would say the only difference is the way I track the work, and I use a form which I handed out copies of called a treatment summary, which allows you to record in a very nifty way, I think, visually all the protocols that were used over time, how they got modified, what the reward settings were. But also on this form, parents have identified 5 concerns that's why they're in treatment, and they track progress with those concerns. And it's the way the form is created that you can actually see the relationship between protocols and improvement, or lack thereof, or sometimes you do a protocol and it's not good. And so this is really useful. If you're doing 20 sessions, you can look at this form and very quickly go, oh, get a real good overview of treatment. The form also tracks medications, so you can remind you to help people to diminish medications, or kids or adults who are on ADD medications. The other aspect in the form is it can show you when treatment is plateaued and you're doing session after session and parents are not reporting any improvement, or adults are not reporting any improvement in themselves. And in those sort of cases, what you really need to do is you do need to change what you've been doing. So the other thing that I mentioned in both webinars is I use a format in my office, a service delivery format, where I have myself, licensed psychologist, but licensed behavioral health care provider of some sort, and I work with my assistant who runs a lot of the sessions. And I've trained my assistant, but I dictate protocols, but she's gotten quite good by now, so she can make modifications. But we have a system of communicating back and forth, also with our charting that I talked about in that second session. The advantage of this 2-person team is, one, it's highly efficient, and secondly, it has a lot of economic advantages, because when she works with clients in the session she does, she can see 2 clients at one time, while I'm doing 1 client one time, but I'm also doing some therapy, and that's what today's session is about. So today's agenda is really, first I want to talk about the rationale for adding what you might consider therapy, well, it is therapy, into neurofeedback in treating ADD, ADHD. And in doing that, let me give a little bit of background about myself and where I come from and talking about doing therapy with this group, kids and adults with ADD, ADHD. I'm a licensed psychologist. I have 20 plus years doing neurofeedback, and I last five, almost exclusively, 5 or 6, exclusively working with Signet. My background prior to doing neurofeedback is I got my PhD at the University of Oregon, and working with children with behavior disorders. I actually graduated in the field of special education and behavior disorders, but published my dissertation in the top 2 psychological journals. So where I was getting my degree, child psychology, um, as much came out of the special education department. But the behavioral model, the social learning model I was trained in, was that children's behavior, if not initiated, is shaped, controlled, can be modified by working through the parents to change the social environment. So this parent training model has been a major thrust of both my background and my continued work. I should mention that I have over 10 publications in this field. I have one regarded text, and currently, I would say the work that now is sort of moved into a name, family behavior therapy, as opposed to cognitive behavioral therapy, but family behavior therapy is now considered the only evidence-based therapy for ADD, ADHD, and its associated problems. So what I'm bringing comes out of that background. But that raises a question. Do we even need to do therapy? Do you even need to do therapy with neurofeedback? And particularly, I'm going to say doing therapy with children and adults who have ADD. And I'm going to make a suggestion or suggest that it is this population in particular that needs the therapy combined with the neurofeedback. And I say that because, okay, my initial hope was, gee, learn to do neurofeedback. I read all the fascinating studies, the great outcomes, do the protocols. Now suddenly these kids are going to focus, cooperate, do their work, do their homework, get along with everybody, family's happy, and IQs are up, grades are up, everybody skips around delirious. And we all get those cases. We all get the clients where we do the straight up neurofeedback and we just knock the ball out of the park. But my sense is that we get that about 50% of the time, if mostly just what we're doing is neurofeedback. And that this is particularly true because a lot of the kids who come to us, there's a lot of issue of conflict with their parents. Some of the children appear unmotivated or depressed, and none of them are very organized. And I think we make a mistake if we assume that the neurofeedback by itself will resolve those issues. I think it's somewhat similar to, I think one of the problems that's befallen psychiatry is that psychiatry has become so enamored of medications that that's the only tool they use. And in doing that tool, they're nowhere near as effective as they might be combining that tool with some other approaches. I'm also going to mention that one of the things I've taken off of the listserv is what I find kind of interesting is that when people talk about having difficulty with their clients and looking for suggestions, of course, they get suggestions on protocols, but often then the suggestions come back. Have you looked at nutrition? Have you looked at pathogens? Have you looked at chemical insults, early trauma, all this stuff? And that's all well and good, but the training, I believe most of the people on the listserv is in some sort of psychotherapy. And that's where the largest literature says that with these sort of problems, we need to look at a therapeutic intervention is probably going to have the biggest impact. But of course, that raises the problem. If you're doing neurofeedback, how do you even do therapy? How do you counsel? Because definitely neurofeedback takes up time, and I'm going to say takes up the majority of time. So this is what I'm going to present, is how I fold the two together, and not only how I do it, but what I actually do in the therapy. And this, I think, comes from my last, I'm going to say, 20 years of work when I keep going back. What is most useful for me to present to families, parents, and kids who have attention deficit disorder? And then later on, I'm going to talk about how I fold the two together. So the first question is, what am I going to cover? What are the things I'm going to present? It's going to be somewhat of a parent training model, and it has to address not just issues of attention, but the most common um, comorbid conditions. And like I said, those tend to be, if not oppositionality, though that is certainly frequent, oppositional behavior, disorganization, poor attention. This is the basket that comes when you talk about ADD. What I do, if you have a training in behavioral family systems or parenting training or that sort of thing, is quite a bit different, though you can sort of see the common roots. Over the years, I have abandoned the use of charts and point systems because they're just too difficult to sustain. They fall apart. They're not worth my effort. You can teach people that set up point charts for homework and blah, 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 and they never do it. I've also strongly, heavily de-emphasized rewards and punishments. And the reason I've done that is because one, almost always you set up a reward system, the kids are enthusiastic about it for a little bit of time, and then they lose interest in the rewards. If you go to simply working on punishments and consequences, then what you often tend to get is a very negative family system. It just destroys relationships. So I'm not there either. And thirdly, the natural consequences that's often part of, let kids fail at this or learn from that, doesn't work with ADD because most often the natural consequence of failure falls to the parent, not the child. So my work, what I'm going to present today, is different in that regard. The other thing is that what I've worked and what I'm going to present has to meet a few other real-world tests. One, it has to be doable by parents who have ADD themselves. So it's been, how can I say, tried and tested with those families, and they find, hey, we can really do this. Secondly, it does not have to have a lot of consistency for it to work. You can have setbacks, and it can still work because what I'm doing is not so structured in that sense. Third, it has to appeal to a wide range of families. I'm here in Eugene, Oregon. This is where all VW buses come to die. We have a strong counterculture influence. I also have a lot of very conservative families who come to see me. And what I present tends to appeal to all ends of the spectrum. It also tends to work with families who are fairly disorganized, as well as families who are fairly intact in their functioning. So that is the background on it. Let me talk about what I cover. And I cover three areas. There's three sets of problems that, and this is sort of somewhat how I slice it and dice it. But the first area is I work with how to improve cooperation in children and teens. And I'm actually going to walk you through the actual training process for that so you get a sense of what it is. But the first thing I've noticed is if you ask your kids and parents when they're sitting there, say, ask them this question: if your mom or dad, or was to ask you to do 10 things during the day, like take your shoes out of the living room, it's time to start your homework, could you help set the table, turn off the computer? How many of those 10 things, and not all at once, so it's not a memory test, how many of those 10 things would you do on the first request without any arguing or fussing and do a good job? So that's the question that I ask them all. And I say, I want a number from 0 to 10. 0 means you'd never do it like that. 10 means always. And what almost always, and it's interesting, kids and adults will give almost identical number, is it's somewhere around 0, 1, or 2. And the problem with it is that level of cooperation makes making anything happen very difficult. So the first area I'm going to work with almost all of my families with is on cooperation. The second area I'm going to work with my families is on a set of skills that teach children how to be organized and responsible. And you may go, I got to hear this one. And actually, and I'm going to go over it briefly, is it's not that difficult. The skills are small. They just have to be implemented over time for it to happen well. So the first one's cooperation. The second one is teaching children to be organized and responsible. And the third one has to do what I call a set of ADD effective parenting, particularly in terms of motivation and discipline. In other words, how do you motivate the ADD kid? And what do you do for discipline when there are behavior problems? And again, I said, I'm not too much in favor of rewards, punishments, and natural consequences. So I had to come up with an alternative. And so that's the third part of what I cover with families. Okay. So to give you an idea of how I do this, I'm going to talk about the area of focusing on cooperation. And by the way, if you should have questions, I think there's a chat system that you can post it to. We changed our webinar platform here, changed a little bit. It's not as smooth as it was. The people who changed it apologize. So if you post a question, it'll be read to me in my ear, and then I will try and answer it. So, but going back to this focus on cooperation, and what I have, one of your handouts is I gave you, I think it's about 6 pages. It covers all 3 areas: focus on cooperation, teaching organization and responsibility, and ADD effective parenting. So you want to read that. You want to be familiar with that material. But what you're going to do is you're going to present this to the parents or parents and child and go over this. So you will have to spend some time in some early session going over this material. So let's go through it. What am I actually doing? So I call this, the whole overarching thing is ADD effective parenting. And today, or what I'm going to teach you, if you are my client, is the whole issue about cooperation. And I'm going to say that, one of the things I've learned over time is that children and teens who have ADD or ADHD rarely do what they are asked to do on the first request without arguing or fussing, and or they don't do a good job. And I might make it an aside. Doesn't mean that they're oppositional, that they won't. But if you just simply ask, that 0 to 10 question, you're going to find the numbers kind of low. And so to improve their attention, this is actually the first place to start. And you go, what's the relationship between attention and cooperation? But if you want a child to cooperate, if you want a child to attend, cooperation gets people to attend. It's, we can say minding, paying attention. It's all kind of rolled into one. Plus, later on, when you're trying to teach children certain skills like organization, if they don't cooperate, you can't really teach much. So this is where we're going to start. And what I'm going to mention is that getting your child to cooperate well is kind of a 7-step process. But I'm just going to go over these. They're not real complicated. And it's just practicing these that make it happen. So let's go over what the first step is. And the first step is you want to be clear what cooperation really means. So real cooperation means doing it right away. Don't fuss or argue. Do a good job. And that's it. A lot of kids operate kind of on the basis that if you ask me to do something and I think it's reasonable and I eventually get it done, what's the problem? But that doesn't really work. And actually, kids know this is the definition of cooperation, because in school, or if they were visiting a friend and a parent asked them to do something, this is what they would do. They do it right away. Don't fuss or argue. Do a good job. So the first thing that a parent needs to do, if they're not doing it in the session here, is to sit down and talk to their child about exactly what cooperation means. And I really want the parents to write these 3 points down and post them somewhere to remind them that getting the job done is not the same as cooperation. Okay. The next step is you want to avoid power struggles because you're trying to get your child to cooperate. And so here I want you to think like a coach. And so coaching isn't a power struggle. Coaching of it is where you tell something, you explain something to somebody about how you want them to do it, and then you observe, see what happens. And if it's done right, you say, great. And if it's not done right, you don't criticize, you just correct without criticism and observe again. And when it's finally done right, you say, good job. This is how a coach might teach a new move in basketball or a new tennis swing or a dance move or any of these things. So what you're doing is you're telling, observing, correcting, observing, correcting, observing. Good job. That's what coaching is. And that's the model that you want to take in changing, improving cooperation with your son or daughter. The key here is you want to focus on the cooperation, not the task itself. For example, if you ask your child to go set the table, if your youngster doesn't move right away, don't repeat the request. Instead, say, I asked you to do something and I need your cooperation. Kids may feel that they shouldn't have to set the table, but should recognize the importance of cooperation. I'm going to mention now there are two mistakes that you want to avoid as a parent. One is don't walk away before observing the child's cooperation. If cooperation is poor, you can bank that they won't do it in your absence. Okay. The second one is don't raise your voice if your child doesn't, comply. You want to go with a pleasant, authoritative voice tone. And if they resist, make your voice more serious, not louder, because good coaching is a matter of encouragement, repetition, and firmness. Another issue that's part of cooperation is the issue of procrastination. And what happens when you ask your child to do something like set the table and they say, can I do it in a few minutes? Or can I finish this first? Or can I do that? Or I'm doing this. And let's assume that they're saying that, reasonably, they're not arguing with you. You have two choices here. While it's better not to encourage procrastination, if you do let them do something later, when later arrives, don't be upset that they forgot. Kids with ADD just won't remember. Instead, simply remind them it's time and observe that they cooperate. So in general, ask them to do, what you've asked first and then get back to what they were doing, as, trains people to kind of take care of their responsibilities and not procrastinate. There's also a couple of phrases that if parents use them, make things go better. One phrase builds around giving a choice of two ways that you can do something. For example, would you rather help set the table or help in the kitchen? Remember, be careful not to ask, would you rather do it now or later? Having choices feels better for everyone. And the other one is that there are ways of phrasing things that invite cooperation, kind of like holding out a carrot helps motivate. You may have heard the grandmother saying, as soon as you finish your vegetables, you can have some pie. And notice that she does not say, you can't have any pie until you eat your vegetables. So these phrases, if you can use them, do so. The last part of this cooperation thing is you do have to address when you're being, really ignored or argued with. And even though your simple efforts to say, come on, I need your cooperation, aren't going anywhere. And the key there is for you to keep calm and stay in control. If your child just ignores you or continues to argue, don't get angry. Rather, in a serious tone, explain that not cooperating makes it hard for you guys to work together. And then assign a make-up task so that it's not just blah, blah, blah. Because when it makes it hard to work together, it makes hard for you. And so the task that you would set out a task that would be helpful to you that might take between 5 and 10 minutes, depending on the age of the child. It could be things like go out and vacuum out the inside of your car, or wash a couple windows, or get some fingerprints off of something. They're small tasks. The key, though, is until the task is done and done right, If the child balks at going off and doing the task, hold back all privileges. And I like to say, no food, phone, fun, friends, or Facebook. Now, what are we looking at? The child is simply looking at, do I do the task or I have this struggle over no privileges? The key is when the child does the task, they are acknowledging your authority to ask them to do things and that they should cooperate. But once the task is done, you wipe the slate clean, everybody moves on. So it cuts down on this overhanging cloud that so many parents and so many of these families seem to experience. The next I want to mention is to never threaten a task. In other words, if your child's not cooperating, don't say, if you don't do that, you're going to be given an extra task. And also, never pile on another task if they balk. In other words, if they don't go right to what you've told them to go do, and then you add a second task and then a third task, now you kind of get into those one of situations where they're going to dig their heels in. Doing the task is the recognition that this is over. And once it's done, wipe the slate clean and get back to what needed to be done in the first place. So a summary of the whole cooperation thing are these techniques. There are 7 of them. And this is what I'm going to want you to be working on as we also do the neurofeedback, because as we do the neurofeedback and you work on cooperation, the two really come together to making a really profoundly positive change in the family. So that's the first thing. That's the cooperation one. Those are the slides. And I'm going to stay here. We also have a slideshow for the next 2 that I'm going to show, but I'm not going to go into them in as much detail. But let me talk about what do we actually do cover. So the next step is teaching kids how to be organized and responsible. And the point that I take from watching kids is that nobody is born knowing how to plan, organize, or manage their lives. That's a given. That's what childhood and that's what growing up and that's what education, it's all about, is learning some of those things. But what's clear for kids with ADD is that they don't usually pick up organizational skills by watching others. Just they do not see it. And so therefore, if you want, and yet you can't go forth into this world, even as an adolescent and certainly not as an adult, without some ability to keep track of stuff, remember what needs to be done, plan, organize, I guess you can. There are people who don't do that, and it's not caused by a head injury. There are people who just don't use these skills. But if a child has these skills, they're going to do so much better. And so we have to get these kids, and particularly kids with ADD, to start developing these skills. So how do you do that? And the key is that kids with ADD, they learn by doing, not by talking. Telling them these skills does not do it. So what I'm going to do is we're going to teach children to be organized by getting them to use the tools of organization. And what exactly are those? Sounds complicated, but it's really not. The 3 tools are lists. I say lists, labels, and reminders, but I'll explain a little bit more on what those are. So lists is really the big one. When you make a list, you're planning something. Even if you're making a shopping list, you're planning what you're going to buy. If you're going to invite friends over to stay, for a function, you are making a list. Let's say you're going to put on a dinner party. You make a list of who you want to invite, what you need to bring, what you need to get, and if it's a potluck, what other people need to bring. That's all planning and organizing. The difference, however, is that oftentimes it's the parents who make the list and give it to the child, when instead the teaching of organization and teaching of how to be responsible is sitting down and asking the child to make the list. The pencil should be in the child's hands, not the parent's hands. Now, the list is better than no list, but the child making the list is really crucial. And even with little kids, who can't write, the idea of making a list can seem very grown up, and they can dictate the list to you. But the key is the stuff on the list should first come out of the child. So what I teach parents to do is for them to come up with lists that need to be done with their son or daughter. And we can do that in the session. They can do that at home, and to post those lists. The three rules about lists are: keep them simple, post them where they'll be seen. And again, the one I really ought to talk about is lists work a lot better if they make them up rather than you make them up. So that's the list piece. The second part of teaching people how to be organized is teach them how to organize stuff, material things. And here it's a 3-step process. Again, the first one is simplify, which is, and I usually have parents work on this with their kids' room, with the child. So the first thing is to go in and sort through just what don't they want anymore, and give it to Goodwill, save it for if the family does garage sales, give it away to other people, throw it in the trash, recycle, or whatever. But it's much easier to organize your stuff if there's less of it. And okay, so that's the first thing, simplify. The next step is with the child to arrange it how everybody would like it done. And arranging, often I say, you may want boxes, bins, hooks, hangers, a file drawer, hanging file, whatever. But you want to get that stuff and you want to put everything where it looks really good. But don't take too long. Just quickly move and do. The third one, and this is the piece that really makes the difference, because if you left it at this, I can guarantee you in a week, it'll look right back to the same disaster zone it looked before. And that's what's discouraging. The third one is to put a label, have the child put a label where everything goes. And so there are marks on the boxes and on the drawers and things like that. Labels help us keep things in order, and they call us back to where to put things. And once you have this process done, if you have a daily routine of straighten up, just like you can have a daily routine of make your bed or brush your teeth, is that the labels, the simplification, and the places where things go keep stuff in order. And for most kids, the 2 areas that they have to organize are their room and their backpack. So that is the organization piece. I also include in this a notion of how to use fairness to your advantage, but that's in the handout. So go read the handout that you got, and so I can move on here. Okay. So the third area, so the first area was cooperation. The second area is organization and responsibility. The third area is, I'm going to say, it's ADD effective alternatives to rewards and punishments, or ADD effective ways to deal with motivation and behavior problems. So not all ADD kids have problems with motivation, but a lot do. And some of them, are really quite depressed. Though my experience has been, I don't know what other people's been, is that a large part of the kids who come in who are depressed because they're locked into an angry struggle with their parents and are shutting down over that. And often that's because the parents have gone down the road of consequences, taking away things and taking away this, and you can't do that. And so the child's just permanently grounded and has no, so it's not a good system. And that's what you get. You get a discouraged, unmotivated, passive-aggressive child. But like I said, I'm not going down the road of rewards. So how do we motivate kids with ADD? Now, again, the cooperation piece should deal largely with the shutdown, constant struggle. You'd be surprised how much the family tone improves from just that. That cooperation is actually a treatment for a lot of depression. But we're talking about the child here who avoids things, finds things too difficult. I'm not good at that, whatever. And so here I come out of some of the things out of the cognitive therapy. One is actually the value of, rather than telling kids things are easy, is acknowledging that this is hard. I believe a lot of children who have difficulty, low sense of competence, have a mistaken notion that things should be easy, and that if they don't come easily to them, there's something wrong with them. So One thing that's listed in the handout and in the slideshow for parents is often saying to kids, this is hard, this is difficult, but also implying that they can do it. Put your mind to it, you can. Um, Similar to this, but also covered here, is getting parents not to enable avoidance. Um, that if you by backing off and avoiding things that are difficult, we actually become weaker and less competent. But then here also the parent has to be aware, is the thing too big for the child to tackle all at once? And if that case, what a parent needs to do is break it down into smaller, easier parts. And again, the handout talks about that. This is the way psychologists um, help people overcome fears. It's also the way, coaches teach complicated skills. I also talk about the value of effort, persistence, and grit as values that you want to highlight, staying out of telling people that they're really smart or they're really good at something. These are really counterproductive things when parents say that. And to develop what's called a growth mindset. If anybody there listening is familiar with the work of Carol Dweck at Stanford, I think this is really relevant here. And also the work name slipping me right now, on grit. Um, the last part in terms of rewards is the value of highlighting positive exceptions. If anybody's had training in solution therapy, that it's really helpful when a parent can point out to a child, wow, that's really good. How you able to do that? How'd you do that? When normally they would have avoided or given up or not stuck with something. So that's where I come from on the reward side of things. On the behavior problems, I talk really about how to enter into problem solving with the child, how to get past defensiveness. I teach to use the phrase, I know you didn't mean for this to happen. Because whatever disaster has just befallen, I can guarantee you that the child, when they set out, did not expect it would turn out the way they did. Either, as they often say, I don't know, I wasn't thinking. That's probably a pretty accurate description how a lot of ADD kids end up in trouble. So why did you do that? Type stuff doesn't go anywhere. Starting out with, I know you didn't mean to do for this to happen, gets all past the defensiveness. And then you talk about helping the child come up with solutions to fix the problem, to be fair about it if people were hurt, and also to set things right. And so here I come back and I encourage the use of what I call reparative consequences, which most often is work, because most times the problematic behavior comes back, befalls the parents. So it's things the child can do that take some time, that in a way say, I harmed you by my action, so this is how I would fix it. The consequences don't have to be terribly great or terribly long. I don't think strong punishments work. Actually, reparative ones are more effective. The other consequence that I talk about in the ADD effective parenting is the use of temporary restrictions and limit setting. And the analogy here would be the way a parent with a very young child walking through a parking lot holds the child's hand so they don't dart out and get hit by a car. As the child shows more maturity, they'll let the child walk by next to them without necessarily holding their hand. And later on, they can send the child to go into the store or walk entirely independently because the child's going to be more cautious. If the child shows a lack of caution, then the wise parent reels back in, brings back in the amount of freedom the child has. But the key here is to make that restriction more temporary so that the child understands that they have a chance to prove after a little bit of time, maybe they can do better. And so it's this increasing the freedom, bringing it back if they can't handle it, increasing it, bringing it back. That's kind of a logical way of managing misbehaviors. I also talk in the handout about dealing with lying, manipulation, and dishonesty. And again, the key points here is pointing out that when you lie, letting the child understand that it damages trust, then a reparative consequence, staying vigilant, but doing the reparative consequence, the work task, wiping the slate clean, but staying vigilant. so that if you think you're being manipulated or lied to, or the child's being dishonest with you, that you repeat this cycle. It will take quite a few repetitions with some kids, but that is an effective way of helping this problem. And lastly, in behavior issues, I talk about when is digital media becoming a problem? And this has been discussed on the listserv. I think the point's well taken. Not all kids is digital media a problem for. They're misusing it or overusing it. But I think we've all seen kids who get locked into, Facebook, texting, whatever, and it just creates problems. And for some reason, there's a fascination sometimes with video gaming for kids with ADD or surfing the internet. And when it is a problem, then I really do talk about eliminating it completely for a period of time. And when I say a period, and I'm not talking hours or days, till behavior improves around, and then reintroducing it in more measured amounts. Now, none of this, all of this, I'm also working with the neurofeedback so that it makes this work a lot easier. It's a lot easier doing therapy when the neurofeedback is making the child easier to work with. But giving these tools to the parents is huge. It's huge. It moves things along a lot faster. So I'm going to really encourage you to think about incorporating this into your work. So that's the what of what I give. How do I give it? Because you've got clients coming in to do neurofeedback, and that takes up your time and attention. So here I go back to the model I've developed, which is that looking at when people do neurofeedback for ADD or ADHD, I tell them we're working for 20 sessions. At the end of 20 sessions, we'll evaluate and see if we're done or not. If we're done, great. If we're not done, we may do more. But of those 20 sessions, I divide it between 15 and 5. 15 are done by my assistant. 5 of the neurofeedback sessions are run by me. And the 15 that are done by my assistant, my clients pay out of pocket for that. And the 5 that are done by me, because I am incorporating the therapy, then I view that as a legitimately billable expense. And everybody's practice is different, but I would say that, my range of people doing this, I do not see a lot of wealthy people, and the fee, what they see is doable for a lot. I am, trying to work with, I'm supporting insurance, but I also see insurance as a problem, because when we start doing 20 or 40 sessions, and realistically to treat these problems, I don't know how much leeway insurance is going to give us, or whether there's fee for session, what they'll pay. When they think of biofeedback and neurofeedback as identical, I can learn to do biofeedback in one weekend seminar and buy a $20 thermometer. And learning to be a good neurofeedback clinician is way more complicated, way more expensive, and requires a much higher level of expertise. So to some degree, keeping the neurofeedback as an out-of-pocket expense works is, I think, much more realistic if you want to run a practice that supports the time and energy and money you put into doing this. But going back to this 15 and 5 model, it's the 5 sessions where we do the therapy. The other 15, that's my assistant doing it. So in the sessions that parents work with me and with the child, now sometimes I just hook the child up, give the parents the material to read or to go over the slideshow, and then we sit and talk about it. Other times I'll go through these early on. Remember, they're getting their neurofeedback. So if I have to spend half of a neurofeedback session with the child and the parents going through that slideshow and explaining it, or if you don't want to use the slideshow, or you don't want to use the handout, just explaining it. But this is the material that I give. Then I send the kids on, put them on the headphones so we can talk. I have headphones that have controlled speakers. I mean, you can control the volume. And I know sometimes the kids turn the volume off on the feedback to listen to what we're saying, but that's okay. I'm never saying anything to a parent that I wouldn't say to a with the child actively listening. But when I'm talking about parenting skills and how parents can change their behavior, and all of my kids are in favor of their parents changing their behavior. So not a problem. But the way I integrate the two is out of the notion that, I just ran through that cooperation. I don't think anybody listening here could go out and do that. Too many points. And you're trained therapists. How do you actually get people to do it? And here, I think that this is like music lessons. The teacher, or dance lessons, or coaching. The coach teaches you something, and then you go back and practice. So, but how do I know they practice? And here, I have a system of integrating the therapy with the neurofeedback, and I do this through parental self-evaluation. And that's what I have on this tracking form. This is the treatment summary, the same one you saw a couple weeks ago, except I had the middle part grayed out. And now you can see here, it's highlighted in red. And so what we have are 3 columns that directly reflect the 3 areas that I covered: focus on cooperation, teaching organization and responsibility, and using ADD effective strategies. But what I'm asking the parents to do, okay, just let me back up just a second. On the left, if you attended the webinar, last webinar, the parents have selected 5 targets. So in this case of Miranda, those were the targets: difficulty completing tasks, poor concentration, poor sustained attention. And those vary. Every patient is different. Every client is different. That's what parents picked. And they rate how their child is doing 0 to 4, where 4 is it's a huge problem, and 0, it's not a problem anymore. And so over the course of the training, what we're looking for is those scores to steadily go down. Okay. We have a question. Okay. So the question is, somebody's working with a 19-year-old who thinks lists are childish, and do I have any suggestions? So the first question is, do I want to treat a 19-year-old like a child or an adult? And again, I'm going to assume that this person is acting somewhat like a normal adult, is within the adult framework. Because if it's a child, I think my orientation is if there's anything that the parent wants the child to do, okay, this is what I need you to get done, or, when they come home, what do you have to get done this evening? Okay, make a list, put it down, then you can scratch it out. Well, I think that's silly. If we've done the cooperation part, then the answer is, come on, just make the list, just do it, and go on, because then we're working with children. You can't do that with a 19-year-old. So I'll cover that next week in working with adults, because I do want adults to make lists too. But you have to come at it slightly differently. Maybe as a little bit of a hint, I'm saying nothing I'm going to suggest to you have to do. But everything I'm going to suggest here, why don't you give it a try and see if it helps? Because our goal, our mutual goal, is at the end of this that you look back and say, this is the most helpful and valuable thing I've done. The neurofeedback was amazing, but my life just goes so much better. So before you discard it, why don't you give me a try and see what we get? So that might be the answer I would do in that case. Again, whatever therapeutic skill, bring it to bear. But going back to this question here of parents rating. So if you look at this form, the first column is the date of the session, and just, keep track of 1 to 20. There you've got your 5 targets. The next 3, though, I'm not asking the parents to rate their child. I'm asking them to rate their own efforts at doing these things. And actually, you wouldn't start entering the rating until you've introduced the skill. But in the slideshow, the last slide is a summary. You saw that. It was the summary of, it looked like the light bulb with the skills, and at the very beginning was the staircase and the skills laying up. You can, after you've presented the skills before, you can just show them that form and say, this is what we're talking about. These are the skills for cooperation. Take a look. How you doing? And don't worry if at the outset your scores are real low, because this is new skill. You're not good at it. And each time they come back, you hand them, and they fill out this form about their kid. You can hand them the summary of the skills, show them that, ask them to evaluate it. And in your therapy session, this gives you content to discuss. Where are things going really well? What are you pleased with? Where are you having trouble? And try not to put what doesn't work for you, because this stuff does work, but where are you having trouble? Where are your difficulty? So you can talk about this at each of the 5 therapy sessions. If you're working with one client at a time in the standard therapist neurofeedback, after you've got the kid hooked up, put headphones on them and talk with the parents about this stuff. Now, you don't have to occupy the entire session talking about it, but what you are saying to parents is, we're talking about this because it is important, and I really want to know what works for you. I'll just also mention that before I start neurofeedback, I tell people, this is one of the things we're going to be doing. I'm going to be teaching you how to get your kid to cooperate, and how to get them to be organized and responsible, and what to do with problems, and how to motivate kids. And they go, great. Thank you that somebody's doing this. This is so much more useful than sometimes people be told to read a book. Or, I've seen handouts from evaluations on 20 things to help kids with ADD. You have to handhold them, work them through this process. But I think you'll be really, not just, I'll say, pleasantly surprised, but kind of really blown away on what you can accomplish when you combine this with the neurofeedback. So let me talk a little. I don't know if there's any questions. If any, I'll come to those. But let me talk about what's in the downloads for this week. Everybody should have gotten the free download. One is the same form filled out last time of Miranda, except that it's the one I just showed you. It's this. It's this form. There's no red line, or there's no highlighting box, but that's just this is the form I use. If you want to create your own version of the form, no questions. Okay. One thing in making this form, is, this is the form. So in the free download, you get a copy of this, and you get the handout that I've created for parents on, ADD effective parenting, how to improve cooperation, how to do organization, and the, consequences, ADD effective ways to motivate and deal with behavior problems. So you have that stuff to work with. What's available in the package that I'm charging for, and again, just for the time and the effort, and also that I have somebody helping me with a lot with the digital graphical end of all this, is you get the blank treatment summary form. Again, this form, but it's totally blank, and you'll get it in 2 formats. One is a fillable PDF, so that you can enter the tasks, the 5 specific concerns. Go back over here. You can enter the 5 specific concerns easily, and you can enter the client's name and then print it out. I use a paper version of this, and that's what I hand people on a clipboard each time they come in. I print it on stock paper, but print it out, you got it. And so I give you a fillable PDF version of this. The other is this was created in Excel. I give you the Excel version because let's say you want to change this form. You don't like the things that I teach, and you want to focus on, are you doing some other things? You could track that. It's for you to modify however you want. So I wanted to give you that. The second thing that's included in the package are the digital slideshows, and they're the one I showed you on cooperation. They're meant to be put on loaded onto an iPad, or however you put them on an iPhone. You can print them out. We will have, I don't have it yet, but I will get it to people. A copy with a white background if you want to just print them out. But basically, that gives you the visual aid as you go through the instruction. You could also just hand the thing to the person and ask them to read each one, and then let's talk about it as they go through it. So it makes it much easier to present this also, that way you don't forget stuff. And I'm going to suggest that you stick to the script fairly closely for a while, and then later on, if you want to modify it to your own needs. So that's what you get in this download. What I would like to do is make a special offer to people. There are 4 webinars, and each webinar had purchasable material. And I'm offering the material from all 4 webinars today, the prior 2, and the one that's going to happen next week. And that entire bundle would be $100. And if you've already purchased for one of the webinars, in other words, you paid $50, I will give you a $50 credit towards this. If you bought the handouts, the bundle from the previous 2, then this is free, and you don't even have to order it. We'll get it sent to you, or I'll check on that, but you'll get it. And the handouts from next week aren't available yet, but they will be available at the next presentation. So you get all 4 of these handouts and material for you to use in your practice for $100. So I hope that's worth it to people. If you do purchase it, it ends up going through PayPal. And please read the instructions as you go through the steps. It's not complicated, but there ends up being a link, something you have to click on to get the material, because we are getting people sometimes said, I ordered the material, paid for it, didn't get it. They're not seeing the link to, now that you've paid for it, click here and it comes to you. It's all digital. I don't know if there are any more questions. Okay. And then the last thing I'll cover is the next webinar, and the last one in the series is next Tuesday, again at 9 a.m. and 5 p.m. Pacific Standard Time. And the topic will be working with adults. So it'll be somewhat similar. What is the therapies that I roll in working with adults? And of course, you can see they're going to be fairly different than what I would work with children. So I will hang out here a little bit if there are any questions. Still good? Okay, we'll give it okay. Okay. Is that something? Nope. Okay. It seems that there are no questions. So again, I really thank you for attending. I hope this has been useful to you. What I would really like from people, even, if you don't purchase anything, is some feedback. You can either send it to me or you can post it to the listserv. Suggestions, comments. I would also really like to hear from people who have tried to implement this and what your experience has been. I think the biggest drawback for me doing these as webinars is I have no interaction really with my audience, and I really miss this. I used to give similar, though not quite the same content before. And the interactions from people, the follow-up feedback, the emails was really great. So I'm exploring this webinar platform as a way to do this, but would really like to hear from people. And if anybody just has an attaboy, I appreciate those too. So, okay, with that, I'll let it go. And again, hope to see and meet with you a week from today. You take care now.